Hi, I'm Dr. Sridhar Kalyanasundaram. Welcome to my channel. This video today is to discuss a few facts about fever. So the video is obviously aimed to educate parents, but from the healthcare professional point of view, if any of you are watching this video, it's more for you to share this information with your families. So I'll be doing it as a PowerPoint presentation. Fever is one of the most common clinical concerns that parents have, and that is one of the main reasons they visit a doctor. So it's very important to know what fever is and how a parent should react to the fever. So fever is nothing but a rise in the body temperature. It's related to a body reaction to potentially harmful stimulus. It can be infection or what the body perceives as a stressful stimulus. It can be like immunization. We may have external factors like overheating, for example, sunstroke in the older kids and heat stroke, or in the newborn babies if you are overwrapping them or keeping them in a warm room. This is more important in the initial period when they may be a bit dehydrated as well. So dehydration also provokes their body temperature to go up. Some medications can cause, though it's not common, and some poisonings can produce fever as well. We often attribute low-grade fever to inflammation in the body, similar to what we see with teething. However, please remember that teething doesn't produce high-grade fever. So a little rise in body temperature can also be seen in the evenings. So the morning body temperature is a bit cooler compared to what we get in the evening. So this is another factor that you should look at, 0.5 degrees centigrade difference. So physical activity, external environmental factors like being in the sun or in a hot car for some time, minor issues like teething can cause temperature to go up. So in general terms, we don't recommend you to measure the temperature unless you think there is fever. So don't routinely check, and this applies even to the newborn babies. If you feel the baby looks pink and is otherwise not excessively warm, you don't need to measure the temperature. How do we measure the temperature? So this is quite a tricky question because there are so many options that we have currently. The ear infrared thermometers are quite commonly used. After 3 months of age, it's quite convenient. In the younger baby, sometimes the tip may not enter into the ear canal, and so the reading may not be accurate. So you have to make an informed decision depending on how small a tip you have. So it's reflective of the core temperature. So from that point of view, it's fairly accurate. And as I said, you need the appropriate sized ear tip. There are the infrared thermometers can be used both on the forehead and on the ear. So you can get these, and these are probably the best option. If the child is sleeping, for example, you don't need to disturb the child by putting the tip in the ear canal. You can check it on the temporal pulse, which is the forehead thermometer. You have the digital thermometers. These are different from the infrared thermometers in that they don't give the reading as quickly. It takes at least 30 seconds to a minute in most instances, so it beeps when it's ready to measure. Until then, you have to keep it in the appropriate place. You can use it for oral use, axillary use, and rectal use. Obviously, if you're using it for a rectal use, you keep it only for the rectal purpose. You wouldn't put it in other areas. And if you have oral thermometer in a younger child, it's very difficult because they don't want to keep still with something in their mouth for a long time. In older children and adults, oral thermometer is an option. Axillary temperature can be measured in infants as well if they cooperate. So this is the best source, even though the axillary temperature is not as accurate, is slightly lower than the core temperature. The oral temperature is also slightly lower temperature, and we should make sure that we don't measure the oral temperature for at least 15 minutes after they've had something cold or warm to drink, because that would influence the oral temperature. Axillary temperature is likely to be lower if the child is sweating, as the cooling produces evaporation, as the sweating evaporates, and then there is cooling related to that. The rectal temperature is as accurate as the core temperature anywhere else, but it is not routinely used as it is invasive. However, we do use it in the neonatal intensive care unit in some stages, especially Most of the low reading thermometers are rectal thermometers. So if you need to check for hypothermia, where the temperature may go below 35 degrees, you may need a rectal probe. And the same is used for the cooling therapeutic hypothermia, which we use in some intensive care units for birth asphyxia. There are skin patch thermometers. These are not accurate as they are more affected by ambient factors. It's difficult to calibrate them. So it's like hit and miss. It may give you the right reading, but you can't trust it. So digital thermometers use electronic heat sensors to record the body temperature, and they give a reading in around a minute. The digital ear thermometers called tympanic thermometers use infrared ray, and these are quicker. The same infrared ray can be used to measure the temporal artery thermometers, and these are the forehead thermometers. All of us are going through a current crisis with the COVID, and so you are used to getting your temporal artery temperature checked as you go into malls or anywhere else. And we do have the thermal cameras which can record for multiple people at the same time, for example, screening at the entrance of a building and so on. So these are the different thermometers, and some of us who are old enough may remember the old mercury thermometer. So obviously we don't use the mercury thermometer anymore. It was quite fascinating to see the mercury which is in the tip of it rise up, and it indicates the temperature. It does take some time to measure, and usually it was used as a oral or axillary thermometer. And we have this is a kind of infrared thermometers for the forehead or ear, and you have a tip to add in case of the ear thermometer. These are the digital thermometers, and you can use the same orally or in axillary area. You need to clean it appropriately after use. So this is an important part where we discuss the normal body temperature. Obviously, where you measure the temperature makes a difference in terms of the exact readings, but similar to any vital sign reading, we are more worried about the range. We are not worried about an exact number. So a slight difference will not make a big difference in your treatment decision. So the rectal thermometer and the ear thermometers, the readings are going to match the core temperature more or less, and the ear thermometer may be a little lower because of the exposure to the environment. So you can see that the range in Fahrenheit is around 98 to 100, and up to 100.4 for the ear thermometer. So if you measure in the mouth or armpit, it's a little lower. Be familiar with one scale so that you're not confused between Celsius and Fahrenheit. Obviously, the progression is there, but it doesn't exactly correlate. And in terms of fever, in a rectal or ear temperature record, we take 38 degrees Celsius or 100.4 degrees centigrade as fever. And in the mouth, it's more than 37.8. And if it is an armpit recording, you may even take 37.2 and above, or 99 degrees and above as fever. So where you record makes a difference. But as I said, if it's a low-grade fever, if the child is well, you wouldn't influence your treatment based on that. So you don't need to be too concerned about minor variations. So how do we know if the temperature rise is serious? So any fever in a baby under 3 months of age, where you're checking in the central temperature, the core temperature is above 38 degrees Celsius, it needs to be evaluated. So the reason is infections can progress quite rapidly in small babies. You may have a serious infection. If you don't pick it up and treat quickly, you may have a septicemia, and the baby may have rapid progression. So even though it could be a viral infection even in small babies, especially if you have siblings affected with a cold, for example, we cannot exactly be sure, and it's better to get them checked. From 3 months to 2 years, you can be a little bit more relaxed if the child looks well in between the fever and is otherwise eating and drinking well. Reduced appetite is normal during the fever. Of course, you have to account for that. If the temperature is below 39 degrees or 102.2 Fahrenheit, you can monitor for 24 hours or so. And if it is an improving trend, you don't necessarily need to consult. In older kids, you can monitor longer if the child is otherwise well. So 2 to 3 days of fever. I mean, if the symptoms do suggest a viral infection like a cold, and the fever is not extreme, child is otherwise well, you can manage with the symptomatic treatment. So apart from young infants, the first 3 months, as I told you, you need to show irrespective of other symptoms. If there is any degree of fever associated with the refusal to eat or drink and the child seems too ill to drink fluids, so fever can cause dehydration. So if they don't drink adequately, you may get worse. And the other factor is that if they are not even keen to drink because fever causes thirst, it might indicate that they are sick. Their sensorium is affected. So diarrhea or repeated vomiting, as well as any signs of dehydration like reduced urine output, if they are less alert and active than usual, then also you should consider. If the child complains of a specific focus, like a sore throat or ear pain, which may mean they have a need for antibiotic possibly, or pain while peeing, which might indicate a urinary tract infection, or a rash in the body, it may be a viral rash, but you need to check for more serious rashes as well, especially if the rash is not blanching. Blanching is the rash changing color when you press on it and release it. So if it's not blanching, it might mean it's like a purpuric rash, petechiae, which is like a blood leaking into the skin. That might mean a very serious problem like meningococcal meningitis. The baby has fever after 24 hours under 2 years of age, or after 48 to 72 hours in older kids. Again, you need to seek attention. If these situations arise, we may need emergency care, which means you don't delay, you don't even wait for the OPD to open the next morning, you take them to the emergency. The child is extremely irritable or fussy with the fever. There is sluggishness and trouble waking up, especially if they are appearing limp or refuse to move. Rash, which I described, purple spots look like petechiae or bruise on the skin. So the glass test, you can keep a glass that we use to drink water on the skin, and if the rash is blanching, you'd see a color change there. It will pale up, and then as you remove the glass, it becomes red again. So this is blanching rash, and the blanching rash is usually less serious. If it doesn't blanch, it means there is a subcutaneous blood leak, which may mean more serious infection. If the child has a stiff neck, there is severe headache or seizure, this is also important. Moderate to severe abdominal pain, because fever can be a manifestation of appendicitis, for example, which may need further evaluation. Urinary tract infections can produce abdominal pain as well. So these are conditions where you may need to review, you may need a test, and according to investigation reports, you may need to decide what to do next. If the child has trouble breathing, especially if there is fast breathing, or the child appears pale or blue, which may indicate that there is difficulty in getting the oxygenation right, this is also an important step, and you may even need to call the ambulance for conditions like fast breathing where the child color is changing, or if the child has seizures or any signs of brain infection. So this is just an overview of fever. So we need to understand that fever is itself not harmful. It's a manifestation of an underlying disease which is causing the fever in the first place. Control of the fever is not an emergency. You can be ready to give symptomatic treatment, as we will discuss in the next video, which will be on management of fever. So I request you to subscribe and also to turn on notifications, because I realize that many of you don't know when new videos are coming out, when we meet in the clinic and so on. So as parents, I would request you to proactively watch these videos, not wait for a problem to happen. So keep the notifications on, and if you find any videos interesting, do share with your friends and relatives. Videos like this will help all parents, and that's the main aim for me to do these. Do put your comments or questions in the comment section, and more interaction would be welcome. I hope this is useful, and see you in the next video.